I'm Philip Mathew. I'm a hand and wrist consultant. I work with my NHS practice at Chelsea and Westminster and in my private practice at the Wellington Hospital in London and a few hospitals in East London as well. I'm a fellowship trained hand surgeon, and my area of expertise is mainly hand and wrist. About 25% of all sport-related injuries are usually hand and wrist. And the incidence is growing, not only because of the competitive level of high school and collegiate athletes, but also due to activities that have increased in the general population. So in the hand and wrist, you have tendons, ligaments, bones, joints with cartilage. And any of these structures can be injured in sport. And it also depends on the type of sport. A variety of sporting activities exist, and with each of these comes a specific hand injury. So it's difficult to say that one is more common than other generically, but within each sport, you may have a preponderance of, say, hand injuries, or you may have a preponderance of wrist injuries. The type of injury depends upon the type of sport. So sports can be divided into a variety of activities. You have combat sports like boxing or martial arts, racket sports like tennis, climbing, rowing, invasion games like football or rugby, where the team has to invade into the opponent's territory and score a point, fielding and striking games like cricket, basketball, where one person's striking an object at a time and someone's catching or hitting it. And then target games like cricket, where you have a set of fielders, one person's bowling, one person's batting. You have net games like volleyball and badminton. Then you have more generic sports like cycling, skiing, snowboarding, gym activities. And more commonly, there's a big resurgence of e-sport, people working or playing a lot of time on Nintendo's, PlayStation, etc. So depending upon the type of sport, you have more specific injuries that can be more common. Combat injuries like boxing, martial arts, you can get finger fractures, you can get wrist fractures, you can get tendon derangements where the tendon's disrupted or moves out of joint, out of its normal position. Climbing, you can get pulley injuries for the tendons which hold the tendon down. Rowing, you can get tendon inflammation on the radial side of the wrist, that's the side of the wrist. Football, rugby, you can get finger injuries in rugby when you're trying to grab your opponent, tendons and finger fractures. Football, falling over, or goalkeepers, scaphoid fractures, distal radius fractures, these are pretty common. So again, it varies depending upon the type of sport. With e-sport, there's a lot more resurgence of tendinitis and thumb pain, carpal tunnel syndrome with holding the wrist in one position for a long period of time, and so on. So it all depends on the type of sport and the variety of injuries that arise, which can all be treated if identified early. These can range from very simple injuries like minor tendon inflammations to more severe injuries like tendon ruptures or pulley ruptures. With respect to the ligaments, so a tendon connects muscle to bone. That's what we've just talked about. Ligaments connect bone to bone. So stretches, tears, partial tears in ligaments are called sprains, and these can be minor, or you can get full tears, which are ligament ruptures and are more serious. You can get fractures, which is a technical term for a break in a bone, and these can be simple hairline fractures, which don't need any intervention operatively, to more significant multi-fragmented, where you have more than one piece. Fractures that go into the joint dislocations, and obviously with increasing severity, these have a significant impact with respect to time off work, time to recovery, time away from competitive level sport, etc. The normal thought process with injuries depends upon the severity, and most injuries can be managed non-operatively. And this though we're saying non-operative and we say surgery is not required, that does not mean no input is required. You need physiotherapy, you need splinting, you need appropriate advice on how to manage that injured finger or wrist while the tissues or the bone heals. And that can sometimes take up to 6 to 8 weeks. However, with more severe injuries, where you have the fracture fragments displaced, the fracture going into the joint, multiple bone fragments, if there's an open wound, if there's an actual tendon rupture, then these are things where you would think about seeing a surgeon for more decisive management with respect to surgery, though in certain situations, non-operative management is still feasible. This depends entirely on the personality of the injury, the personality of the patient, their needs and demands and requirements. A professional violinist with a finger injury has different needs and requirements from a rugby player with a similar finger injury. I'm a strong proponent of shared decision-making, where we discuss the pros and cons of options available, and I guide the patient in the decision-making process. We're moved away from the one-size-fits-all concept. So the treatment has to be tailored to the injury and the patient that's in front of me, and that may vary from non-operative management with splinting and guided physiotherapy with an experienced hand therapist, or it may well involve surgical intervention with plates and screws, external fixators, etc., depending upon what's appropriate for that particular type of injury.